excellent, this program is crappy, what is the definition? I mean, what's the measure of that? So is it that they have more, are they measuring more results, or are they just some wonderful model?
We're looking at a number of things. I mean, we're looking at our funded programs right now in these studies, and so you know those programs themselves, you know, are within that little world. I think if you're talking about going outside our current arena, then, you know, or even with those halfway houses, if they work with it, because some of them do work with outside agencies, I mean, our requirement for them is you need to be very aware of what those outside agencies do. You're free to contract with them, or you're free to send folks to them, but you need to be very aware of what they do, and you need to take on that quality assurance role internally and look at your outside agencies and make sure that the programming they're doing matches with the ideal for the facility that you're working within. Is that?
Well, correct me if I'm wrong, but this is specific to the study and to the programs that you're evaluating. Is that correct?
Yes. Okay. And I mean, this is the roadmap for all of the programs that we are currently funding. And should we ever receive additional funding for expansion, these are the things that we would look at for programs we would expand to.
And I might add too, in terms of the forest and the trees, Alicia deals through her shop with both and very well. And part of the detail is in using a validated risk needs assessment instrument, using it properly, and matching programming. When Alicia said, we see that every offender gets AOD programming and anger management and cognitive skills regardless of risk and needs. That will impact on outcomes. And so they're looking at that level of detail for very real fidelity to the principles that drive effective correctional programming. And what these studies have, this past study, 2002, showed, and what I would anticipate we see more of into this study coming along, is that fidelity matters a great deal to improving outcomes. And the University of Cincinnati and the Canadians have been very good about developing what they call a correctional program assessment inventory that really is almost a scale of sorts you can use to measure organizational and program compliance with what you should be doing routinely in dealing with offenders. So you don't do harm and you get to the outcomes that matter.
Right, which is why I was talking about how crucial that quality assurance piece is. I would actually prefer that we would use the continuous quality improvement, which goes beyond and not only says, are we doing well at what we do, but how can we make it better? And it takes these components that we have used in our audits, and my expectation of the program is always trying to be better. So that we can go on to our next person, who actually, Paula will be talking about what is a very, very critical element to doing these programs and doing them well. And I will yield the floor to Paula.
Right, well, thank you very much for inviting me. I am Canadian, so I have to excuse my Canadian accent. My students tell me I have not lost it. I can never get through a presentation without saying about at least once. So, although I have virtually eliminated A from my vocabulary, so you should be hearing of those pop out hopefully over the next little bit. I should be able to hold together for 20 minutes anyway. So. I do have to actually start by saying that coming from the Canadian system, I moved to Ohio about 5 years ago, and I have been so impressed with what the state of Ohio has been doing, really what Alicia talked about in terms of looking at program level characteristics and associating it with recidivism has received really international attention, because there really aren't very many jurisdictions that have done this large scale. And that allow us to really look at the predictive validity of looking at a program's adherence with the principles of effective intervention, and then really being able to correlate it in a fairly fairly rigorous way with treatment effectiveness. So, my short answer to your question about how do you distinguish a good program from a bad program, from our point of view at UC, a good program is one that, one, empirically has shown reductions in recidivism as measured by looking at the clients who've gone through the program versus those who are in the comparison group, and two, programs that scored high on measures of program integrity. And luckily for us, what the research shows is that there's a high correlation between programs that do score high on those measures of program integrity and their treatment effectiveness. And so what I'm going to present today, I'm actually going to only present pieces of this. I have way more in here than we could actually cover today. Many of it's the minutiae of data, which I know has a tendency to induce narcolepsy, especially at 9:30 in the morning. So I'll sort of just talk more in broad strokes about it, but I'm absolutely happy to share the presentation or talk about any of the results specifically after. So this project really is related in a really important way, as I mentioned, to the previous study looking at measures of program integrity, because the risk assessment system will really give the programs important information that will allow them to, if they use that risk assessment information well, to be able to adhere better to the principles of effective intervention. And I'm not going to talk about these in any great detail, but essentially, there is now really an incontrovertible amount of evidence that clearly allows us to make distinctions between programs that are likely going to do well and programs that don't. And so while this outcome study was done in Ohio, the UC database alone contains now well over 500 programs nationwide that have been assessed with measures of integrity, and it's also been done in Canada, Australia, parts of the UK as well. And there's been quite an impressive convergence of results. And so just, in really broad strokes, essentially we talk about risk-need and responsivity in terms of principles of effective intervention. I know we have a sophisticated audience and you've probably heard all that before. But basically, what the ODRC will do is allow programs to identify who they should be targeting, what they should be targeting, and then also will give them some information around how they should best deliver interventions or services in order to maximize the likelihood that an offender is going to engage and benefit from them. So when we talk about risk, obviously what we know about risk is that future criminal behavior can be predicted by assessing risk factors, and matching levels of treatment and services to the risk level of the client is incredibly important. And so what the ODRC will allow programs to do, or agencies to do at various points of the system, is to be able to assess and to identify higher risk offenders. And then hopefully to be able to match them with more intensive supervision, treatment, and so forth. And to avoid, hopefully, at least creating separate tracks in the program or making modifications for the low risk offenders so that we decrease the likelihood that we end up having a detrimental impact on them. Because as Alicia mentioned, it's been pretty true in the Ohio data and absolutely true in the data at large, showing that low risk offenders are detrimentally affected when they're subjected to treatment that's too intense for their needs. Yeah.
Has it been identified the reason or reasons for that?
To some extent, yeah. I think that we still have lots of areas to be able to fine tune. I think probably there's a couple of reasons. One is that if you're lower risk, it means by definition you have some protective factors. Mm-hmm. So for example, maybe you have a job, maybe your family is, somewhat supportive and so forth. If you, for example, incarcerate those folks or you put them in treatment services that are pretty intense, what you end up doing is disrupting some of those protective factors. I think the other thing that probably is really important is that, if you were to say to me, you have one question to ask